most of these young swimmers who have a little bit of instability or rotator cuff tendonitis or impingement, in most cases, do they get better with the non-operative physical therapy treatment program, or do some of them need to wind up going to surgery?
Well, a large majority of them can be controlled very nicely. It's interesting, a lot of these swimmers will have what's called an MDI, or a multi-directional instability. All that means that they're really pretty loose. That's what that means. And the very large majority of those, if you do a really good core and scapular control exercise program, they can stay in the water and they can do pretty well. If you try to treat them with rotator cuff exercises, then you will be unsuccessful, and then you'll say, well, I need to fix these surgically. Well, and sometimes they work and sometimes they don't. If these swimmers really do fail this really good rehabilitation program, like we've talked about from the core up, or if they truly have a rotator cuff tear, which is relatively rare in most swimmers until you get up into the very high levels, they may have this laxity, they may have some labral injury, and sometimes those need to be fixed. But if you take a MRI of just about any swimmer who's any good, who has shoulder pain, they will have this lax capsule. I mean, that's why they're good. And so just operating on an MRI is not the reason to operate on somebody with a swimmer's shoulder. They have to have the right symptoms. They have to have the right physical findings. They have to have failed the physical therapy. And then those are the ones, the small percentage that can benefit from surgery if you do, once again, the right operation. And it's not going in there and trying to take care of these quote-unquote bone spurs that are causing impingement, because most of the time that's not the problem. It's the laxity and the capsular problems and the labral problems that give most of these patients symptoms.